I'm sure you must have seen them in
Yes, in
aircraft.
aircraft,
And
yes.
they go from Abuja to Lagos
Yes.
and do something bad and come back. The issue is that if we are able to also manage our own environment, for example, there's something that people do when they go to a vulcanizer and the vulcanizer finishes with their tire, an old tire, they carry it and go home. The vulcanizer will say, Oga, leave the tire for me now. Make I sell them. He said, no, I'm going to take it home. They take it home. The next rain, Paul puts water inside that place. After some days, go and kick that tire. You will see about 50-something mosquitoes will come out from that place ready to bite. And these are the things we do. Sometimes, we put bottles around our houses because we want to prevent thieves. And then the bottles are upside down. When it rains, water, and a bigger thief is breathing inside and killing
the one that
people.
steals lives.
Yes. So these are some of the things. Sometimes we are looking for water. We get these cans and then we leave them open.
Actually, I'm glad you mentioned that, because one of the things that I saw recently, talking about World Malaria Day, unfortunately, I didn't pay enough attention. But what I was able to get out of that documentary was the fact that there are parts of the world where it's not a case of they've eradicated mosquitoes, but their mosquitoes don't give malaria. How does that work? It's as if there is something that they've immunized the mosquitoes to not now give malaria. How does it work?
Mosquito is not the whole culprit. The issue is that mosquito is just a victim of circumstances. Yes. Because if I don't have malaria, you don't have malaria, mosquito will still bite us and go away. You are actually the one that infects the mosquito. In the first instance, it's man that infects the mosquito.
Oh, so there is mosquito that's not carrying malaria. If it bites me, I won't have malaria.
Yes.
Okay.
Indeed, there are so many of them that don't have malaria. And if it bites somebody who doesn't have malaria, it can bite another person and another person and another person, and nothing happens. But once you have one person that has malaria, and that's why if you come to a family, when one person has malaria, after a week or two, you see somebody else begin to say, look, I'm feeling. It's because the mosquito was infected. And then the mosquito decided to infect another. So, but if we are careful, for example, in countries that you are talking about, if we are able to reduce, there's something that's called slight positivity rate, where you get 100 people and you test them for malaria, and you find out how many of them out of the 100 have malaria. That's how we know that we are doing something effective. Previously, we used to have, if you have 100 people, you can test them about 60 people or 50-something people will test positive. Yeah, we have the parasites in their blood. But right now, it's coming down to, there are several studies. Some are saying 20. Some are saying 18, 16. Out of 100. Meaning that we are doing, and if you look at what the statistics is showing, that about 49% reduction has come in. I personally have seen, because I've been in this for a long time, since 2000 when we had the summit. I know what we used to, when we'd go for training, we basically just take the blood of people to test out, and you see the parasite there. But now you have to arrange for certain positive blood from maybe a teaching hospital or somewhere else. And people that are watching us actually know they are having less malaria.
I was going to ask as well, because I know that there was a time, not too long ago, that I had malaria, and a test was done. They said, yes, I've got malaria. I was tested, I was treated. And then I went back for further test, and I was then told that it's not completely gone. I wasn't feeling feverish. I wasn't feeling unwell, but they said it's not completely gone, that I still need to use some dosage of medication to clear it completely. So I was thinking, is it possible for one to still carry that and still have the mosquitoes bite, not really cause any damage, but then go and cause damage with other people?
Again, that's the issue with malaria. There are several things with this, what you have just said now. First of all, we are fighting to ensure that people use the right drugs. If you use ACT, artemisinin combination therapy, it wipes the parasites clean from your body. So even if you're having a constitutional symptom, it will go down. But if they take your blood, they won't see the parasite, and it's gone. But previously, we were using chloroquine and some of the other ones that they are, if you treat them, we treat about 100 people. The result we got in 2002 was if you treat 100 people, only about 30 something of them will get all right, which is not good. Yeah, and that's why we are changing. The change is to artemisinin combination therapy. So one thing that could have happened is that they may have given you something that didn't effectively clear the parasites, and that's why they remained. The other issue is that, yes, you may have some constitutional symptoms, and it has wiped the parasite. If you are doing rapid diagnostic tests, which is what we are introducing now, and which happens, you can get the results in 15, 20 minutes. Sometimes because it's looking at antigen, that test looks at antigen. Sometimes when even the parasites have been wiped up, the antigen may just last for a few extra days. So if you do some tests, it may still be positive for those few days before it clears from your body. Those are the things that may have happened. But instructively, we are looking at ensuring that people know that artemisinin combination therapy is what they should use.
Now, is there any drug that one can use to prevent malaria, like the Daraprim of old?
Yeah, I was expecting this because a lot of people have been asking about those. I was one of those that took that Sunday medicine those days when I was in secondary school. Yeah, we have not yet entered the stage when we can use that because there's an issue. Those days when you use those Sunday medicine, what they are trying to do is to prevent you from having malaria at all, and you are not building immunity. And after several months, if you ever miss that drug and you have malaria, it will be a devastating one.
Yes.
That's what happens to white people when they come here, and they fail to take their drugs, and they come in here. They have kidney failure, ordinary malaria that you can even have and have your program continue. When they have it, they have organ failure. So that's what was happening, and that's why we are not advising. But there's a stage we will get to, and we will seriously begin to advocate for. That's why we're talking about seasonal malaria chemo prevention, which is a new intervention we are doing now, but not everywhere. It's only happening in places where we have short periods of malaria, like in the northern fringes of Nigeria, the Sahelian regions, and all that. That's when we'll begin to introduce those chemo prevention, but not for us now, because the level of our epidemiology of malaria hasn't reached that level when we can do this.
Okay, well, we have to wrap up now. So let me ask you, Boladale, your final words. Can you use it in helping Nigerians who are watching and anybody else around the world who's watching us online to say these are 2-3 things that you need to definitely do to help reduce malaria in Nigeria?
Okay, thank you very much. One of the first things we're going to talk about is the issue of environment, which Dr. Nwokolo has already mentioned. Please let us keep our environment clean and tidy. Our gutters we should have free flow gutters. We should also ensure that, our pregnant women also attend antenatal classes. When we go into antenatal classes, we are being educated on, how to prevent malaria in pregnancy, which is also a very, very big issue in Nigeria. Prevention of malaria in pregnancy by attending antenatal classes. Also, treatment, ensuring that when you go for treatment, you're tested before you're treated. So the right kind of medication can be given to you, and for us to be able to eradicate this very deadly disease. So 3 key things.
Anything you want to add to that?
Just to say that people should get the nets and
use it.
It's important. And now we are doing a lot of community outreaches. I think people should buy into that. If people are interested, they should contact Society for Family Health. We're able to help.
Society for Family
Health. Yes, we're able to
contact Society for Family Health where? Phone number?
Okay.
Email?
Yeah. Okay. Well, maybe I'll just give my email, nwokolo@sfhnigeria.org. Okay. It's something that is near to our heart, and we are able to do that to help a lot of people. Have outreaches and make sure these nets get to people. And when they get those nets, let them use them.
Okay. All right. Thank you very much. We really appreciate the time spent with us and enlightening for all of us, especially Nigerians, who may not understand what this is all about. Thanks, Boladale Akin-Kolapo, the Deputy Director, Expanded Social Marketing Project in Nigeria, and also Dr. Ernest Nwokolo, Director, Global Fund Malaria Project. Thank you very much.
Thank you.
So, Sunrise will take a short break. Whatever you do, go get that net. It is supposed to be free, but worst case scenario, you should spend it worthwhile. 100 naira. Even if they sell it for 200, still buy one and have it in their home, especially for kids, but adults as well. But everyone should get one. So we'll take a short break. When we're back, another interesting conversation awaits.